In a big boost to fight against COVID-19, government grants exemption from basic custom duty and Health Cess on the import of ventilators, face and surgical masks, PPE and COVID-19 test kits. Centre approves COVID-19 emergency response and health system preparedness package. 100% financial aid economic package will help states procure essential medical equipment and medicines. 15,000 crores to be given in 3 phases from Jan 2020 to March 2024. The number of total confirmed coronavirus cases in India goes up to 6,412. 199 people have lost their lives due to the pandemic so far. 503 people discharged after successful treatment. Centre dispatches 10 high-level teams to 9 states to enhance cooperation. Prime Minister Narendra Modi's efforts to collaborate with countries around the world on COVID-19 continue. Prime Minister talks over phone with President of South Korea and Uganda. Israeli Prime Minister Benjamin Netanyahu thanks Prime Minister for sending chloroquine to Israel. Police maintaining strict vigil in sealed areas in Delhi and Uttar Pradesh. Movement of people stopped. Authorities ensure door-to-door delivery of essential items in such areas. Delhi government running Operation Shield in hotspot areas. Number of new cases rises rapidly in Maharashtra and Madhya Pradesh. Maharashtra has the highest count of COVID-19 patients. Death of corona-infected doctor in Indore of Madhya Pradesh. Odisha extends the duration of lockdown till April 30th. Many states make wearing masks on face mandatory. The war against corona continues in the world. Nearly 1.6 million people infected. More than 95,000 people killed. US records 1,783 virus deaths in the past 24 hours. United Kingdom's Prime Minister Boris Johnson out of ICU but remains in hospital. IMF says 170 countries are expected to see negative per capita income growth this year. United Nations Security Council meets for the first time over coronavirus. UN Secretary General Antonio Guterres says world faces its gravest test since the founding of this organization. A signal of unity and resolve from the council would count a lot. Good morning. Welcome to English News. I'm Anil Thomas. Now for the stories in detail. Considering the immediate requirement of ventilators and other items, the central government has granted exemption from basic custom duty and Health Cess on the import of some goods with immediate effect. These goods include ventilators, face masks, surgical masks, personal protection equipment or PPE, COVID-19 test kits and inputs for manufacture of the above items. The basic custom duty exemption shall be available up to the 30th of September 2020. India imports about 80% of its medical devices requirement. At present, the Health Cess on medical equipment is 5% over and above the custom duty of 7.5%. The total duty varies between 11 and 22% depending on the product. The centre has approved a comprehensive package to provide assistance to the state in the fight against COVID-19 pandemic. This package, called the COVID-19 Emergency Response and Health System Preparedness Package, is a 100% centrally funded scheme aimed at enhancing the infrastructure in the states to meet the coronavirus epidemic challenge. The package is called the India COVID-19 Emergency Response and Health System Preparedness Package. Under it, the government has sanctioned 15,000 crores for India COVID-19 Emergency Response and Health System Preparedness. Of the funds sanctioned, 7,774 crores will be utilized for immediate COVID-19 emergency response and rest for medium-term support. The project will be implemented in 3 phases. The phase 1 of this particular project is from January 2020 to June 2020. Phase 2 of this particular package is from July 2020 to March 2021. Phase 3 is from April 2021 to March 2024. The key objectives of this particular package include mounting emergency response to slow and limit COVID-19 through the development of diagnostic and COVID-19 dedicated treatment facilities, centralized procurement of essential medical equipment and drugs required for the treatment of infected patients, strengthening and to build resilient national and state health systems to support prevention and preparedness for future disease outbreaks, setting up of laboratories and to bolster the surveillance activities, biosecurity preparedness and pandemic research, proactively engage community and conduct risk communication activities. Prime Minister in his address to the nation on the 24th of March highlighted that the central government has provisioned 15,000 crore rupees for testing coronavirus patients and strengthening the medical infrastructure of the country. As on date,
अब कोरोना के मरीजों के इलाज के लिए देश के हेल्थ इंफ्रास्ट्रक्चर को और मजबूत बनाने के लिए केंद्र सरकार ने आज 15,000 करोड़ रुपए का प्रावधान किया है। इससे कोरोना से जुड़ी टेस्टिंग फैसिलिटीज, पर्सनल प्रोटेक्टिव इक्विपमेंट्स, आइसोलेशन बेड्स, आईसीयू बेड्स, वेंटिलेटर्स और अन्य जरूरी साधनों की संख्या तेजी से बढ़ाई जाएगी। साथ ही मेडिकल और पैरामेडिकल मैन पावर की ट्रेनिंग का काम भी किया जाएगा। मैंने राज्य सरकारों से अनुरोध किया है कि इस समय सभी राज्यों की पहली प्राथमिकता सिर्फ और सिर्फ स्वास्थ्य सेवाएं ही होनी चाहिए, हेल्थ केयर ही प्राथमिकता होनी चाहिए।
As on date, a total of 223 labs comprising of a network of 157 government and 66 private laboratories are conducting rigorous screening process. Furthermore, Ministry of Health and Family Welfare has already disbursed 4,113 crores to all states and union territories for dealing with the emergency COVID response. The number of active COVID-19 cases in the country has risen to 5,709 according to the Ministry of Health and Family Welfare. 199 people have lost their lives to the disease and as many as 503 people have been cured and discharged from hospital while one has migrated. Well, for more on that particular story, Nitendra Singh, our correspondent covering health, joining us on the phone line. Nitendra, good morning. Nitendra, spike in numbers, spike in the number of deaths, but also positive is the number of recoveries that we are seeing now. That's crossing 503. Take us through what's happened overnight with regards to COVID-19 and the response that India is putting up.
गुड मॉर्निंग अनिल। निश्चित तौर पे जिस तरीके से मामले बढ़ रहे हैं तेजी से, उसी तरीके से लोग ठीक भी हो रहे हैं और ये मामले इसलिए आपको दिख रहे हैं बढ़ते हुए क्योंकि जब कॉन्टैक्ट ट्रेसिंग हो रही है और जितने लोग अब्रॉड से आए हैं, संक्रमित देश से आए हैं, उनके जो इंक्यूबेशन पीरियड पूरे हो चुके हैं, उसके अलावा जो लोग उनके संपर्क में आए हैं उनके इंक्यूबेशन पीरियड एक तरह से पूरा हो चुका है और कॉन्टैक्ट ट्रेसिंग जिस तरीके से बड़े पैमाने पे हो रहा है, घर घर एक तरह से लोगों की जांच हो रही है, तो उसमें पॉजिटिव केसेस आपको देखने को मिलने बड़े हुए। इसके अलावा जो लोग ठीक हो रहे हैं, 500 से ज्यादा लोग ठीक हो चुके हैं अब तक, वो इलाज के बाद घर जा चुके हैं। तो ये भी एक अच्छी खबर है कि अगर आप डॉक्टर की सलाह मानेंगे, जो प्रोटोकॉल है उसका पालन करेंगे तो आप इससे बेहतर तरीके से ठीक हो सकते हैं। इसमें जो बार बार बताया जाता है स्वास्थ्य मंत्रालय की तरफ से, डॉक्टर्स की तरफ से कि 80% लोग हैं उनको एकदम मामूली सिम्टम आता है, बिल्कुल माइनर सिम्टम आता है और ओनली 15% ऐसे लोग हैं जिनको हॉस्पिटल में एडमिट करने की जरूरत पड़ती है और सिर्फ 5% लोगों को वेंटिलेटर या फिर उनको और लाइफ सपोर्ट सिस्टम की जरूरत पड़ती है। तो ये किसका आंकड़ा है। अगर आप सोशल डिस्टेंसिंग का पालन करेंगे, घर के अंदर रहेंगे और बार बार जो अपने हाथ की सफाई करते रहेंगे तो पर्सनल हाइजीन मेंटेन रखेंगे और डिस्टेंस जो है 3 फीट और 1 मीटर की दूरी बनाए रखेंगे तो इसके जो संक्रमण के जो चेन है उसको तोड़ने में कामयाबी मिलेगी।
Nitendra, looking at now the central government granting exemption of basic custom duty and also the health cess on the import of some of the goods that are required by doctors, nurses and paramedical staff, how much of it do you see was the need of the hour, and how much of it is India dependent on when it comes to importing these kind of things?
देखिए, जो सरकार कई स्तरों पे इस में काम करे, खासतौर पे पीपीई की बात हो या N95 मास्क की बात हो या फिर और भी जो जरूरी सामान है उनको लेकर के जो घरेलू जो प्रोडक्शन है उसको बढ़ाने पे ज्यादा जोर दिया जा रहा है। खासतौर पे 20 ऐसी कंपनियां हैं जिनकी पहचान की गई है भारत के अंदर जो पीपीई बना रही हैं या फिर जो N95 मास्क बना रहे, DRDO भी उसमें शामिल है। इसके अलावा 1 करोड़ से ज्यादा पीपीई किट को और 49,000 अराउंड 50,000 वेंटिलेटर का ऑर्डर दिया गया है और वो ऑर्डर अब कुछ ही दिनों में पहुंचने वाला है। वो तमाम सामान भारत में अब आ जाएंगे और भारत के अंदर भी कुछ निर्माण किया जा रहा है। तो एक जो डॉक्टरों की डिमांड है या फिर जो हेल्थ केयर वर्कर्स हैं उनके लिए जो पीपीई की जरूरत है उसको लेकर एक बड़ा कदम है सरकार की तरफ से, और कि किसी भी तरीके से कोई कमी ना हो, इसको जो लोग फ्रंट लाइनर है जो इसको हैंडल कर रहे हैं। इसके अलावा मैं ये भी बताना चाहूंगा कि अनिल की सरकार ने ये भी कदम उठाया कि जो 9 राज्य हैं उसमें ज्यादा केसेस देखने को मिल रहे हैं। उसमें केंद्र ने 10 टीम अलग अलग बना करके भेजी हुई है। वो टीम जाकर खुद मॉनिटर करेगी, राज्य सरकार को सहयोग करेगी और किस तरीके से इफेक्टिव तरीके से इस पे काम किया जाए इसको लेकर के डायरेक्शन दिया जाएगा। तो वो एक्सपर्ट की टीम जा रही है 9 राज्यों में। अनिल।
Okay, Nitendra, thank you and appreciate you joining us this morning with those inputs there on that particular story on the steps taken by the central government and also helping the state governments in combating COVID-19. Moving on, staying with COVID-19, but moving on with the number of cases of COVID-19 still increasing, government has adopted a cluster control containment strategy. Steps are being taken to prevent the spread of the virus by sealing of identified hotspots. In New Delhi, Operation Shield has been launched to curb the spread of the COVID-19 pandemic. 20 areas have been identified as containment zones in Delhi. These areas have been sealed. People are not being allowed to enter or exit from these areas. With the area under total lockdown, essential supplies will be delivered to homes. The government will conduct rigorous sanitization of the locality. The government has also made it mandatory to wear masks while outside one's home. Similar measures were also taken in Uttar Pradesh. Among the 15 districts, 22 specific places in Gautam Budh Nagar were declared hotspots and sealed. Movement within these hotspots is completely restricted, with no one allowed inside or outside. Supplies of essential items is the only form of movement allowed in the areas. Strict action will be taken against any person violating the sealing orders. Meanwhile, 6 new positive cases have been found in Meerut. These new cases have been found in Mawana, Parikshitgarh and Humayun Nagar. Positive cases in Meerut have now risen to 43. Uttar Pradesh Chief Minister Yogi Adityanath has warned district officials that if 100% sealing of hotspots was not carried out, situation would become dangerous not just for them but for the entire district. In a video conferencing with health officials and police officers, the Chief Minister gave out strict directions saying cure of coronavirus lies in discipline. He also directed them to open up L2 level coronavirus hospitals in every district and to undertake containment exercise by taking samples of suspected persons and sending them to labs for testing. He added that sample collection centers must be set up in all districts, and he also directed them to ensure that ventilators are fully functional in hospitals and that fire safety must be ensured there. The officials have also been asked to ensure medicines, food to those who are quarantined. Yogi Adityanath, the Chief Minister, has also urged people to cover their face with masks, dupatta or any other cloth when they move out. Moving to western part of India and Maharashtra, meanwhile, the number of new cases are increasing rapidly in Maharashtra and in central India, that's Madhya Pradesh. Maharashtra has the highest count of COVID-19 patients. 72 people have lost their life in Maharashtra, while 117 people have been cured and discharged from hospitals after treatment. In Gadchiroli, the CRPF sprayed and sanitized throughout the region to keep the coronavirus infection free. The CRPF has also appealed to people to stay indoors. In Madhya Pradesh, a 62-year-old doctor who had tested positive for COVID-19 died in Indore. The victim was a general physician. Authorities have meanwhile sealed Indore, Bhopal and Ujjain districts to control the spread of COVID-19. The Odisha government has meanwhile decided to extend the ongoing lockdown in the state till April 30th to effectively contain the spread of COVID-19. Schools and other educational institutions will remain closed till June 17th. Tamil Nadu reported 96 more positive cases of COVID-19. This has taken the state's total to 834 infected cases. Speaking to reporters last evening, State Health Secretary Bila Rajesh said that of the persons who tested positive, 84 were linked to the Tabligh-e-Jamaat conference which took place in New Delhi last month. Of the remaining 12, 3 persons were found to have travelled between states, while 9 others were found to have been in contact with those who were found positive for COVID-19. The Tamil Nadu government has traced 1,480 persons who attended the Delhi conference, of which 763 persons have tested positive. Israeli Prime Minister Benjamin Netanyahu thanked Prime Minister Narendra Modi for his decision to approve the supply of chloroquine to Israel. This comes after US President Donald Trump and Brazilian President Jair Bolsonaro took to their official handle on Twitter to thank Prime Minister for lifting the ban on the export of the anti-malaria drug that is proving to be effective in treating of COVID-19 infection. Netanyahu in a tweet said, and I quote, "Thank you, my dear friend, Prime Minister of India Narendra Modi, for sending chloroquine to Israel. All the citizens of Israel, thank you." Earlier, Prime Minister Narendra Modi on Thursday spoke on telephone with the President of the Republic of Korea, Moon Jae-in. The two leaders discussed COVID-19 global pandemic and the challenges it poses to the global health systems and the economic situations. They shared information about the steps taken in their countries to tackle the pandemic. Prime Minister Modi expressed appreciation for the technology-based response deployed by Korea for managing the crisis. President Moon Jae-in appreciated the way Indian authorities have motivated the vast Indian population for fighting the pandemic with a unity of purpose. The Korean president thanked Prime Minister for the support being provided by Indian authorities to Korean citizens in India. Prime Minister expressed appreciation to the Republic of Korean government for helping the supplies and transport of medical equipment being sourced by Indian companies. The two leaders agreed that their experts would continue to consult each other and share experiences as they research solutions for COVID-19. The Prime Minister also had a telephonic conversation with the President of the Republic of Uganda, Yoweri. The two leaders discussed the health and economic challenges arising out of COVID-19 pandemic. Prime Minister assured President Museveni that India stands in solidarity with its friends in Africa during the present health crisis and would extend all possible support to the Ugandan government's efforts to control the spread of the virus in its territory. Prime Minister expressed his appreciation for the goodwill and care extended to the Indian diaspora in Uganda by the host government and society, including during the present situation. Both leaders shared the hope that the world would soon prevail over the challenge of COVID-19. Responding to a call by Prime Minister Narendra Modi, the 22 Central and All India Services Association and state associations have joined hands together on a common IT-enabled permanent solution platform, Karuna, to support and supplement the efforts made by the central and state governments in fighting the COVID pandemic. Around 10% members currently in the CC WhatsApp group platform are in critical positions in government and leading relief efforts in the department field from all across India. The group members played a key role in removing bottlenecks in key areas such as procurement of ventilators, distribution of kits, shelter to migrant workers. Relief to over 4,000 families have been organized so far by the Karuna team. The informal association network are exchanging real-time bottlenecks to their association members, which are being shared either on WhatsApp, and corrective action is being taken due to the vast human capital in the group that is being harnessed to provide solutions to field functionaries. The Karuna online architecture works through creation of various work groups. There are 6 immediate response work groups functioning on Karuna, namely the first one on migration and shelter, the second one on migration, food and logistics, the third on migration, medicine and logistics, the fourth on healthcare, PPE logistics, the fifth healthcare and masks, the 6th on healthcare ventilators, and the 7th I Got Health. Each channel is headed by a member of Karuna called Lead, with around 4 to 5 core members in support, all working from home purely on voluntary basis in great camaraderie to ideate, identify, anticipate issues relating to their work group channels, completely without hierarchy and service boundaries. Well, for more on the story, Vishal Baristo, our correspondent from Jaipur, joining us this morning on the phone line. Vishal, good morning. Vishal, give us a sense of what's happened overnight in the state of Rajasthan when it comes to the numbers.
Yes, good morning, Anil. I hope you can hear me.
Yes, we can. You go ahead.
Well, Anil, the Chief Minister has decided that all the 196 urban areas of Rajasthan will now have a mask compulsory, and that also includes the mandis and sub-mandis. And the Chief Minister has also come up with an appeal in all the newspapers that you need to follow the rules of the quarantine very strictly. He also says that in Bhilwara, 25 patients who were positive have now been treated negative, but still it's a long way to go, because in the last 24 hours, 80 new patients have been identified as positive, and also there have been 2 deaths, one in Jaipur and one in Kota. So Rajasthan is all geared up. As far as Ramganj is concerned, let me tell you that it has been divided into 30 different clusters, and now they have already adopted the Bhilwara model for aggressive containment of the spread of virus, and that is what the government is doing. And it is not only the wall city, but beyond the wall city, the focus is on rapid sampling and testing. So everybody who has been in contact or has had a foreign travel history, they are being screened, and door-to-door survey is also on, where the A&Ms, the team of A&Ms, along with the nursing students, they are visiting each and every house asking for the number of members, whether they traveled abroad in the last 15 days, and if they have any complaint of cold, flu and cough. So everything is being monitored at the local area level.
You know, also when it comes to, Vishal, when you look at it purely in terms of, the numbers that are spiking, is that the curve in Rajasthan that's slowly getting flattened, or do you still see numbers rising?
Anil, the numbers have certainly spiked because people are still not following the social distancing norm, and especially when it comes to the Ramganj area of the wall city. And the Chief Minister has expressed his concern because authorities, they are trying their level best. Even the whole area is locked, and it's very unfortunate because few months back, the city of the wall city was declared the heritage city by the UNESCO. Now it is all locked. But despite that, people do try and violate the norms of the lockdown, and this is very unfortunate. And also, the Markaz is becoming a big challenge for the state authorities. To quote an example, a family of 8 were infected by a driver who had a taxi driver who had carried the Markaz people from a different place. So this is certainly a big challenge, and the walled city area, the Ramganj area, they are in the hypersensitive zone, and authorities are trying their level best. And let me tell you that the government has already decided that all the students, barring class 10 and 12, they would be promoted without any exam. And also the private schools have been asked not to ask for tuition fee for 3 months. So all efforts are being made, but as the Prime Minister said, that we need to focus on social distancing. And also the Ayush app is also very important, and the authorities are saying that you should have that Ayush app so that you are always aware of what to do and what not to do.
Okay, we'll leave it there. Thank you and appreciate you joining us this morning with those updates there from the state of Rajasthan in particular. Well, that's all we have time for in this edition of news. But remember, stay safe, stay indoors, be positive, cultivate and live in a positive environment. That's all from me. Thanks for watching. Bye-bye.